let's start with today's session of Rhinology. Covered almost all the images of your Scott Brown, Stellenmarin, and but pertaining to like I have included some images from the GNA and the nasopharyngeal carcinoma as well. Starting with the today's session, we'll be covering it into two parts, part 1 and part 2. Just go a little bit quick. Okay. So coming to the first question, which has been asked, like in my 5 years of what I'm seeing the DNB exams, at least twice they have asked in the DNB, and once they have asked in FAT also. Okay, so let's go with this question. Honey saline irrigation of the nasal cavity has therapeutic use. Identify the most potent honey used for the management of this CRS. Okay, so again we'll make it a little bit interactive thing. So there's no fun in telling that the answer for the first part is Manuka honey. Okay. Now, what is the principal active ingredient responsible for the antibacterial property? Can somebody like to take a try?
Methyl glyoxal.
Yeah, methyl glyoxal. Okay. What third question, like which can be potential one? Like this is commonly found in which country? New Zealand. Okay. And apart from that, this is derived from which year? The name of this is Leptospermum scoparium. Okay. And two organisms which can be eradicated using the honey saline irrigation में एक तो हर जगह Pseudomonas आ जाएगा, and apart from Pseudomonas it can be MRSA, that is the resistant one or the sensitive one. Achha, one more thing, like if supposedly a question comes like so and so disease in ENT is caused by which organism. See, this one scenario that you know the answer, you straight away write the answer. But if you don't know the answer, the thing that you can go ahead with Pseudomonas. That can be a rough, wild guess if you don't know anything about the answer. Okay. So moving ahead. So this is the image which they have taken from. The image is from Scott Brown, and all the answers which he said. The first one, the name of this, the Manuka. Second, derived from New Zealand. 2, and the active ingredient is methyl glyoxal, MgO. Okay, and these are the organisms which it is active against. Okay, so please remember these things, and this can be a potential repeat question. It's very important. Okay, so mark it important, and then let's proceed further. Now, if you get this case of any case of rhinology, for your generally it comes as a short case. अगर CRS with polyp आया या इस तरीके का some case is there, FRS is there, it will come as a short case, and this is I'll say a quintessential question. You cannot escape this question. You'll give all the history of CRS with nasal polyp, and he'll ask you that Doctor, what are the DDs of nasal obstruction? Now, I like to take that question myself as a resident. Okay? Like supposedly if I'm a resident, first year, second year, third year, kuch bhi, okay? And somebody asks me this question. Okay? So as a resident, if someone asks me this question, so I will straight away go, sir, DD of nasal obstruction, sir, one is CRS with polyp. I'll straight away start with the first thing which I'm knowing about. Hai na? Second, sir, AFRS, then third, sir, JNA, fourth, like this. But again, try to reframe the answer. Whenever you reframe the answer, you always give a better impression to the examiner, and that is what matters, how to gain better marks, how to gain more marks. Okay, so you can divide it two times. One is you can divide it either this way. Yes, sir, I would like to divide it between unilateral and bilateral causes, or the traditional which we have we have been ratifying since age immemorial. We can start. So it can be congenital. So congenital mein it is choanal atresia. It can be encephalocele. Okay. Traumatic can lead to DNS. Okay. Infectious mein it can be rhinosporidiosis, rhinoscleromatis. Okay. Inflammatory mein it can be CRS, it can be AFRS, the polyps. Okay. Tumor again can be divided into benign and malignant. In benign, it can be GNA, inverted papilloma. Okay. There is a question that how many percentage of inverted papilloma turn malignant. Okay. And it can be squamous cell carcinoma. There can be other granulomatous disorders. cause this thing. Okay, so please this is a point which you have to make it ready. Like if examiner asks this question, you should not start framing at that time. You should be ready with this answer. I have to go this way, and you should be praying to Lord that just a minute. And you should be praying to God that if you get this question, CRS with polyp as a short case, you should be thinking about this question as the first one and attempt it bravely. Okay, don't make the mistake which is routinely expected of the person. Okay, so moving ahead. Now, very important question. Rhinosporidiosis asks many times. The first question is, this is derived from which organism? This is Rhinosporidiosis febri, which is a mycetozoa. Okay, and apart from that, एक तो यहाँ पे nose में we are able to see. Apart from this, it can be seen as an ocular lesion also, especially in the conjunctiva, in the lip, palate, uvula, maxilla, and even larynx. So how can this question come? It can come that what are the other sites where you can see this infection. So इसको पहचानना कैसे? Rhinosporidiosis में this generally they give this type of image in which there is an opening of the pores and these pores are seen to come out. Okay, and two things which are associated with it is, first is the tropical climate, and generally there is a history of swimming which is given in the question. Okay. And treatment mein the important thing is dapsone. Just remember the name. Okay, they might ask you the other way around, that what is the drug which is used for rhinosporidiosis, by just giving the HPE images, and or they might give this drug only to you. They might give dapsone. They might ask you the mechanism of action and one use in ENT. Okay, so this page is blank. Now coming to the brother of this rhinosporidiosis, I always had very much confusion between both of them. There are some questions which are always unclear. Okay, so rhinoscleroma, two questions which you have to remember. See, this is a what is this deformity called as? Can somebody take a try?
Wood nose.
Wood nose. Wood nose bhi hai, but the exact name which generally most zebra nose. Zebra nose.
Tapir nose.
Tapir nose. Okay, these are the three names which you should remember. Okay, second question which they ask from rhinoscleromatis is stages. Okay, which is mentioned here: catral, granulomatous, and the fibrotic stages. Third question is the HPE, and fifth Mikulicz cells. Without Mikulicz cells, I'll just just go through these both of these HPE images. Okay, Mikulicz cells and Russell cell bodies, both of these are associated question with rhinoscleromatis. Okay, so these are the questions which can be asked from rhinoscleromatis. Okay, moving ahead. See, this is the first question which I told you that you can either divide it as unilateral or bilateral nasal obstruction causes. You can go either the first one which we saw, the congenital, inflammatory, traumatic, infectious, malignancy, us tarike se you can say. Otherwise, you can go as per as this description, that is unilateral and bilateral. Okay. Now coming to some very important full forms. So now I will koi try karo. If anyone is not not an issue, can somebody take a try on NARES? NARES? Anybody?
Non-allergic rhinitis with macular syndrome.
Great. This is This is non-allergic rhinitis and last session mein area was the question which was asked in exam. Okay, area 1 marks, CV at 1 marks. Okay, so last session this exam was not conducted in our institute, so I was not able to get the first hand images also. We got the feedback from students that this was the question, this was the question. So I have all the 20 questions based on memory. उसके previous वाले session के like we have the exact images also that I'll share with you, area and CBNet and all. So this is important, like these type of short forms will give you exact 1 mark, है ना? So please don't make a mistake. Keep on accumulating them at a single place so that it will be helpful for you. Okay. Second goes to EPOS. Okay. EPOS is European Position Paper on Rhinosinusitis and Nasal Polyp. ठीक है. If your viva is on, if your case is CRS with polyp, FRAS, anything like that, be prepared that he will ask you EPOS. He will ask you the like salient points, salient features of EPOS. Okay. Then comes the third one, that is distant cousin of EPOS, Euphoria. E से हो गया आपका यूरोपियन फोरम फॉर रिसर्च एंड education in allergy and airway. ठीक है. तो NERS, EPOS, Euphoria. Then comes the very old question. I'll say it has been, we have been learning them since our UG days also. So cartilaginous. ठीक है. Cartilaginous में कार में कितने पहिए होते हैं? 4. So you have to make 4 columns. 1, 2, 3, 4. So what are the 4 components of cartilaginous syndrome? Can somebody take a try? आएगा? 1 नंबर का आएगा? हाँ बोलो. Bronchiectasis. Yes, Dr. Sneha. First is okay. Ahead. Situs inversus. Great. 2 बचे.
Azoospermia.
Azoospermia is a part of young syndrome. ठीक है, ऐसे याद रखना. See, I wanted that this thing to happen. Therefore, I have placed them one below the other. Azoospermia. ठीक है. How I had learnt it? There is a young person who has the problem of sperm. This is how I remembered. ठीक है. ऐसे याद करना. Don't make this mistake in the exam. Okay. So we will be young पे बाद में आएंगे. तो bronchiectasis हो गया, situs inversus हो गया. 2 बचे. चलो try.
Nasal polyposis.
Nasal polyp exactly नहीं दिया हुआ है. It is your ciliary dyskinesia and sinusitis. You can write it. If you don't remember sinusitis, फिर तो कुछ भी लिख दो. But जो exact what they have mentioned, first option should be this. उसके बाद आप इसको लिखें. ठीक है. Young syndrome में you have to write azoospermia plus sinopulmonary disease. Sinopulmonary disease. Okay. Now again, Samster triad. क्या होता है triad? Take it a try.
Nasal polyposis, asthma.
Yeah. Aspirin, asthma and nasal polyp. Okay, so this is correct. So please remember these 3 names. एक साथ याद करना. Because the problem is that it's not that you have not learned it. The problem is that when they will be asking what is young or what is cartilaginous, इधर पे ये ऐसे time चल रहा होगा. 3:59 होगा. When you have started reading, this pressure will make you do mistakes. So that's why revision is important for these type of mistakes, that it should not happen on the main forum. Okay, so moving ahead. So this is the logo of EPOS which they published in 2020. So this you should remember. Now coming ahead, after the Young syndrome which you saw, just see there is something called as Young's operation also. Okay. Young's operation also. So what they have done? Yeah, great. I was about to ask this thing only, that where is it used? So it is a surgery for atrophic rhinitis. There are multiple named surgeries. I've just picked up Young's for today. So in this Young surgery, they have sealed everything. Okay. Now if somebody said ki bhaiya, you have sealed everything, how will the work go? So they made a small hole and sealed rest of the thing. So that was modified Young operation. Okay. So this is the atrophic rhinitis for you. Okay. The answers are these: cartilaginous, sinusitis over here. Okay. And Samtostrad here, NERS here. So moving ahead here, you have to remember what are the symptoms for acute bacterial rhinosinusitis. So 3 out of 4 should be present over here. Second question is image guided surgery or navigation. Okay. So this thing is all given in rhinology also. This thing is given in your skull base also, in recent advances also. So making it a potential question. Okay, whenever anything is there which can be asked from 2-3 sections, it always becomes important. Therefore, this IGS is important for you. So just go through this. This is all what they can ask. Identify what is being I'd give the diagnosis to, or if they want to make it difficult, they can ask you to mention some details about navigation surgery, जिसमें आपका tracking और ये वाला formula आता है. Okay. Now coming to this ahead, everybody has heard this name of Disagio classification. It basically classifies into two parts. First is the non-invasive, जिसमें आपका क्या क्या आता है non-invasive में. The first one is fungal ball, and second I'll say it is the father of all the topics in rhinology. Please study it first before going to anything else. FRS. ठीक है. This has potential to come as an individual OSCE. This has potential to come as a case. Potential to come as a table viva. Potential to come as a whole NCCT PNS of AFRS can be asked. Okay. So it will be discussed. अभी आप पहुंचेंगे तो we'll keep on discussing. It is important. Okay. Now second thing, it can be invasive. तो invasive में आपका आ जाएगा acute invasive, which is your mucormycosis. Okay. Or it can be chronic invasive. This is how generally you can divide it. Okay. Whatever you have studied now, again over here, I think second time maybe we are going on Bent and Gun classification. There is no need to say, it is very, very important. You have to ratify it. Okay? You can use the mnemonic also of that Tana Patekar wala mnemonic, you can use it. Otherwise, there is no big deal in learning it. You all have learned multiple things. Just ratify it. It is important. It will help you out. Okay. Now it is repeated the image of that IGS image of AFRS. Okay, so AFRS में the questions which will be there, I'll just enumerate them. Okay, since it has been like AFRS का, I'll say it's a revision only. So the first thing is, the first question about AFRS is whether this is septate or it is aseptate. Okay, so you have to see the HPE image. Okay, you can see the HPE image and see how they have mentioned it over here. I'll just बड़ा करूँगा, ठीक है. This image is from Scott Brown itself. I've not taken anything else today. Image अभी और कुछ नहीं उठाया, इसे Scott Brown का ही है, ठीक है. This is the first one, ठीक है. So they can ask you that see this is black arrow. Okay, so black arrow is showing eosinophils. So they can ask you identify the cell. Okay, and eosinophil aggregate. So yellow asterisk है, this is the eosinophil aggregate 2, and charcot leaden crystal is the blue arrow. This. So they can point it A, B, C ऐसे करके दे सकते हैं, and you will be asked to identify what is A, what is B, what is C, and they can give you this type of thing, that fungal hyphae, black arrow with 45-degree branching यहाँ पे, and there is septation. So septation होता है तुम्हारा aspergillus में, है ना. So this is how you have to just tell कि this is aspergillus or this is your mucormycosis वाला fungus. Okay. Second question is, what are the stains which you use for AFRS? Can somebody take a try? दो कम से कम बताना है.
Gomarium.
Yeah, the first stain is methenamine silver. ठीक है. Now second one, can someone take a try? Again, G. Brocot. ठीक है. And third is the easy one, KOH staining. Okay. This you have got it. You know that mucor is aseptate, aspergillus is septate. Okay. Moving ahead. This is can be asked. ठीक है. कि कुफरबर्ग में किस तरीके का फाइंडिंग है, what is the grading? तो 1, 2, 3, 4 इसको याद कर लेना. Now इसमें नीचे वाला, again this image is from Scott Brown. What they can give it, they will not ask you to like answer everything detailed. What questions can be there? See, this is almost repetition of above. Okay, कि normal mucosal edema, polyp edema and sinus polyp, almost same, है ना. No edema, mucosal edema, polypoid edema, frank polyp, ये तो सब कुछ same हो गया. Now what is the difference in this Felport-Zever staging में? Marks आपको याद रखना, ठीक है. What are the total marks which they are giving, and what are the total marks which they are giving? That's it. Okay, just go through it once. Now see what this patient is going, जो MAD आपका ले रहा है, position you should see it once. ठीक है. What is the name of position? They might give you this image and ask you that enumerate the name of the position. तो नाम क्या है position का? MyGINT. MYGINT. You can remember it in whatever way comfortable to you. Now coming to this thing, see below is the answer. Now this is the characteristic image which they had earlier asked. Just go through the CT scan. I'll just make it easy for you. Just have a look at this side. This lesion which is pushing the structures toward this side. Okay, so what is this basically? This is a mucosal within a concha bullosa. What the question can be asked is, first is identify the condition. So you will have to answer that this is a mucosal, and second thing is this is most common in which sinus, least common in which sinus. So answer I have written it already. Most common in frontal sinus and least common in sphenoid sinus. Okay, so this gentleman's image, you would have seen him multiple times. So that same frontal sinus mucosal का आपको image can be given. Okay. Now coming to the another question. This was my long answer question in my theory. Okay. So after that I had to learn about fiber of dysplasia. I did not know this can be this much important. Okay. So fiber of dysplasia, what you have to know, remember that first of all that it is of 3 types. Okay. They can give you the history. अभी history में we'll have a look what you have to see. They can give you this scan and they can ask you what are the types. So first is monostotic, second is polyostotic, and third is cherubism. ठीक है, what is cherubism? We'll just deal it in a 2 to 3 things. What is cherubism basically? इसमें क्या होता है कि जो आपका रेडियोग्राफ होता है, in the radiograph what happens, there is soap bubble appearance and there is expanded region within. It is commonly seen in this cherubism is commonly seen in maxilla and mandible. Please remember this question in osteology section when we will be dealing with maxilla and mandible. Again this fiber of dysplasia will come. Okay? That time I will just put up the CT scan in front of you, some history of the patient, and ask you to identify. Please remember it. Okay. अच्छा, यहाँ पे third question which can come is this one. I'll highlight it. This genetic disease is a result of mutation in the GNAS1 gene located on this chromosome, which is important for G protein. Okay. So please just go through it. It is important. And इसके अलावा जो 2-3 point है, that is this is a autosomal dominant disease, AD. ठीक है, this is an autosomal dominant disease and there is a mutation which is found in this SH3BP2. This is the name of mutation. Since I made a gross gadda in fiber of dysplasia in my main exam, so after that when I read all these things, so I was a bit guilty also कि यार इसमें इतना कुछ है, and this was the only thing which I remembered in my long answer. Monostotic, polyostotic, and cherubism. So I had to make all the story around it. So all these things can be written. These all things can be a potential OSCE also. They will give you this image of a CT scan. They'll ask you what is the mutation, how is it inherited, what are the types, all those things. Okay. Chalo. Moving ahead. See, this is the X-ray of. This is the HRCT scan of bony remodeling of your cherubism. Okay. So you can see how the expanded regions are seen. And ये है cherubism का बच्चा जिसके ऊपर like over which they have taken the name of cherubism, this child. Okay. Now after AFRS, this is the second most important thing, frontal recess. ठीक है. First important thing AFRS के बाद frontal recess. Okay. Now can somebody again unmute and help me with the boundaries of frontal recess? I'll just anterior. Then posterior. Anterior is agarnase. Okay. And what is posterior and medial? Can somebody also help me with that?
Posterior bulla.
Posterior is your bulla. Ethmoid bulla plus अगर suprabullar cell है तो उसका भी कुछ part आ जाएगा. ठीक है. But if you say bulla, that is more than enough. Medial में क्या आएगा?
Middle turbinate.
Middle turbinate. And lateral में क्या आएगा?
Lamina.
ठीक है. N for N, L for L. ठीक है. Anyhow you should remember, but you have to remember. Okay. Please remember the CT scans which have been shared for frontal recess. It is important. Okay. Again, I'll enumerate all these things. Actually, I'll repeat those messages at least 4 to 5 times again. Okay. In recent advances, again, we'll have a revision class. Okay. And believe me, jo mock test which we'll be undergoing, these will be the questions which will be repeated again. Because see, if something new comes, okay, if something is there like which DNB have decided here, we will screw up the people. that's okay. Na? If it's wrong, everybody is doing wrong. It's okay. If somebody is too good, he's writing it pretty okay. But if something is as easy as frontal recess, as easy as sphenoid bone का Delano classification, optic nerve पूछ रहे हैं, तुम्हारा Kennedy's nipple दे रहे हैं, anterior ethmoidal artery पूछ रहे हैं, तो that should not be made wrong. 50% paper of OSCE is okay, is easily doable. तो आप कुछ भी नहीं करेंगे. You have read your 3 years book. You fairly will do it. The only problem which everybody face, I also face, and everybody faces, is the duration which is there between the theory and the practical exam. So that gap is the thing which creates all the problem. We don't revise it. Okay, so please go through these images of your frontal recess. It is important. I just included it over here. Now coming over here, like in otology, complications of COM is important. ऐसे ही rhinosinusitis में complication of CRS is very important. So the name of this complication is Chandler's classification. ठीक है? Please remember it. These are the types: orbital, intracranial, bony, and chronic. Okay? They can even ask you this question also: what is the most common type of orbital complication of CRS? You have to write preseptal cellulitis if something is asked like this. What is the most common intracranial complication? You have to write subdural lymphoma for that question. Okay, so don't get confused on that part. Now just see the CT scan. Now can you see this thing? Is it appreciable? Just delete it. Now can you see this thing? Red arrow जो दिख रहा है, they can easily ask you what does this red arrow stands for, what is Chandler's classification, enumerate it, and there will be only 4 minutes to answer, so there will be the problem. Okay, so just see this thing, how this medial orbital यहाँ पे आपका subperiosteal abscess is there. Are you able to appreciate? Everybody is with me ना? अभी it's only 25 minutes we have started, 20 minutes more to go. Okay, please don't doze off. Okay, again, this can be a spotter, Pott's puffy tumor, because it has both clinical image. ये नहीं आएगा, they will give it something else, but something of this sort only. So there will be an opening over the forehead, वहाँ से pus is coming, something like that, and you can see it the same over here also. ठीक है? You can see the same in this scan also. How there is a fistula, the cutaneous fistula which is there, and how there is erosion of the anterior frontal sinus wall. Okay. ठीक है? Okay. Now after this, 2 more questions from this thing. I'll just enumerate it. ठीक है? Please go through it. First is your types of frontal cell. ठीक है? इसका डायग्राम के साथ प्रैक्टिस करना. You would have learnt it. Cone cells करके है. Wormald had modified them, but the basics which you have learnt from your initial days, that in type 1 there is a single cell above the agar nasi, in type 2 there is group of cells, then type 3 में large cells which is less than 50%, and 4th में more than 50%. That you should remember. Second question में, sorry, second question में there is pneumatization of sphenoid which is important. ठीक है? And after that pneumatization of sphenoid, there is one point that the pneumatization of sphenoid starts at 14 years of age. एक ये important है, and this can be divided into 3 parts: conchal, precellular, and cellular. This is there, है ना? Now over here 2 drugs which you have to remember. First will be your omalizumab. I have included it in my जो भी forthcoming slides है. This is important. इसके अलावा और भी कई सारे maps है. We will share it. It is important. Then there is posaconazole, voriconazole, and amphotericin. All the types. ठीक है? Lipid emulsion, liposomal और the normal वाली है सारी मिलाकर. ठीक है? So this was the first part. Please stay with me for next 15-20 minutes. Okay. Now, just see this question. ठीक है? This is your again, what is the identify the drug which you can see, and what is the mechanism of action, what is the dose, what is indication. Okay, so we all know that this is your omalizumab, and the mechanism of action, what is the mechanism of action? That this is a anti-IgE.
Inhibitor.
Okay. So, and what is the indication? Generally, we use it as severe allergic rhinitis for severe allergic rhinitis. Okay. And side effects like what are the disadvantages which can be with this drug? First will be your cost. It is an expensive drug. There can be an anaphylaxis reaction associated. या तेल मचा सकते हैं. But cost is a real-time problematic thing. Okay. Now, after omalizumab, moving ahead. Now, just go through this scan. Can somebody see and comment? This is a, I'll say 40 बोल रहा हूँ. 40-year-old. Great. You nailed it without the history only. This is the Hallman-Miller sign. Okay. There's no fun in telling that this is seen in GNA. Okay. This is the same thing which they have mentioned again. So basically, this is the this is seen in GNA, and this is basically the anterior bowing of the posterior wall of maxillary sinus. Okay. Now this will be followed by its cousin brothers, that is Ramaran sign, chopstick sign, Pandusa sign. Please go through it. It is important. Okay. This can be asked in multiple ways. Okay. So I'll not waste my time over here. I'll just lead you to the other questions. Now over here, just see this image. Okay. This can be shown to you as a GIF or video based question. Followed by that, they'll give you a go through this MRI picture of the patient, and then they might or might not give you this staining wala picture. Okay? So what you have to remember, कि antibodies are stained against what? Antibodies are stained against the laminin. This is one important. Second question which they can ask is, what is the marker, endothelial cell marker for this GNA? That is CD31. Okay, so that is important. Please go through it. They can very well ask you what is this asterisk which is there, what is this red arrow, what is this black arrow. So all the answers is given in this picture. Please go through it. Okay. Now, what are the start questions which they also ask for GNA? I'll enumerate it. First, what is the branchial arch theory of GNA? So, जब आप classification of GNA and theories of GNA, when you start reading, you'll just find it. The first one always there is branchial arch theory. So therefore, the possibility of being asked is also very important. Apart from that, there are multiple other theories. Please remember 2-3 नाम याद रख लेना. Ringer's theory, Sohm and Nefson theory, or whatever 2-3 you have remembered. Branchial arch theory you should not forget. Then comes the spread. Spread is important of GNA also. And why? Because over here, after this you study, when we'll be going to skull base, we'll see the anatomy of your this pterygoballatine stuff. Okay, so how does it spread? It's important. And the final question over here is your embolization in GNA. Embolization in GNA. This was a, like I'll say, short answer question also. But here also an image-based question also they'll ask you. Now these are the stages. Multiple staging hai. Okay, you should remember the main ones. Still, if your mind has the capacity to remember others also, please remember them. But don't forget Radkowski. Don't forget Andrew Fish. Okay, they generally this is the very favorite of examiners. Okay, but if in your institution, like some other classification, if you have been following, please follow that. Remember that. Now, what is the name of this classical facies? Frog facies. Okay? Frog facies of a GNA. Please remember it. Okay? Now, this is your branchial arch theory. Okay, go through it if you have not gone through it. Now, after GNA, the second question in this section will be your osteomas. So, there is a named classification over here in the osteoma and types of osteoma. Only two things you have to remember. So, the name is Few and Persin classification. You can pronounce it as you like. So basically, they classified the osteomas in 3 categories. First will be your this one, ivory or hibernated osteoma. Second will be your mature osteoma, and third will be your mixed osteoma. Just remember the name, okay? And this is not important. Now, other questions of rhinology. We all know this thing. What is UPSIT? Contents of the kit, advantage. Now, can somebody again unmute and try to take this full form of what is UPSIT?
University of Pennsylvania Identification Test.
Great. Okay, so then everybody almost wrote it correct. University of Pennsylvania स्मेल आइडेंटिफिकेशन टेस्ट, ठीक है, तो 1 नंबर हो गया। कंटेंट्स ऑफ द किट, नाउ कंटेंट्स ऑफ द किट में जो टू नेम, या हाँ बताइए डॉक्टर चैत्रा।
40 different smells, 10 in each page, 4 pages.
Exactly. And how do you scratch it? अब देखो कुछ दिखा?
Pencil.
हाँ, पेंसिल, ठीक है। I was asked this question that this is my personal viva question. So my emotions are attached. Okay, so he asked me what is UPSIT. Okay, I'm like, I was knowing it, I answered. Contents of it, somehow I managed to answer. Now that Dr. Sir asked me that how will you scratch them? तो अभी I was like कि अभी क्या है, उंगली से स्क्रैच कर लो। I was about to say that, मतलब नाखून से कर देंगे, ठीक है, but I remembered कि भाई this is not India, Pennsylvania, something else will be there. See, देखो Pennsylvania, I'm sorry, I just cracked a joke also. Pennsylvania, and there is pencil which is involved. Sorry, but he told me that this is not India that you'll scratch it with your finger. There's a pencil given to you. Okay, so please remember it. This can be asked. Okay, this is a self-administered test kit, which is 10 to 15 minutes they can take, and you have to your result will be there. Apart from here, please read about rhinomanometry. ठीक है, एक्टिव एज वेल एज पैसिव, ठीक है। नॉर्मली व्हाट हैपेंस, वी रीड एवरीथिंग, बट जो एनाटॉमी एंड फिजियोलॉजी वाला सेक्शन है, वी टेंड टू ओवरलुक इट, वी टेंड टू आई नॉट से फॉरगेट इट, आई से इट इज जनरली ओवरलुकड, है ना, कि वी नो दिस थिंग, वी आर डूइंग सर्जरी, हाउ कैन दीस थिंग्स मैटर, बट दीस स्मॉल थिंग्स जनरली मैटर। ओके, सो प्लीज व्हेनेवर नेक्स्ट टाइम यू ओपन योर स्क्वाड्रॉन और योर नोट्स, प्लीज जस्ट फिजियोलॉजी वाला जो सेक्शन है, just go through them once or twice. Okay, that is my request. Now coming to 2-3 questions more from this anatomy and physiology of your nose. One is your K area. So they'll ask you what is K area of nose. That is basically the keystone area. That is basically the junction. I've taken this screenshot over here. Junction between the nasal bone, upper lateral cartilage, septal cartilage, and the ethmoid. So this is one question, K area. Second question is your scroll area. ठीक है, so just go through it. K area, scroll area आपने कर दिया। उसके अलावा जो questions which can come over here is this is your nasal cycle, external nasal wall, internal nasal wall, Cottel's test, modified Cottel's test, ठीक है। अच्छा, आप can somebody unmute and try what is Cottel's test? You must have seen yeah, exactly, and you would have seen that image of that patient. Uska supposedly he's saying that I have problem on my right side. So if you pull the cheek, okay, to that affected side, he'll feel better. So you can say that the problem is in the external nasal wall. Okay, if the same thing is being done by the help of a Jobson horn probe or some probe, so this can be called as modified Cottel test. Okay, so this was the question which was asked multiple amount of number of times. Okay, so these are the questions. These questions I saw when I was going through that section of analogy. Okay, इसमें से आपका what is important is CICO. Just remember the full form. CICO this, and there's something called as DART. Just थोड़ा सा off track गया, but just remember it. This is difficult airway response team. ठीक है, अभी over here only I'll just like to include 2 things. Yesterday's session there was an image shared of Vilda laryngoscope. Please remember it. It is very important. ठीक है, they ask कि ये कहाँ use करते हैं? The procedure is Dolman procedure. Multiple things you can answer, but this you should remember. ठीक है, endoscopic pouch का आपका जब diabetic lung का they do endoscopic stapling, so there this is used. Okay, so please remember it. Now coming to this is images of rhytidectomy. What kind of question can come? They can ask you that what is this incision called as, where else इसका क्या variation होता है ना? So all these things can come from this rhytidectomy question. What is rhytidectomy? All these things can be there. Now, coming to this image, identify this instrument. What is the wavelength of CO2 laser uses in ENT? So it becomes a easy shot. कि अगर ये CO2 laser बोल रहा है तो identify आप करेंगे कि this is a CO2 laser. Now, second question goes for you. What is the wavelength of CO2 laser?
10,000.
10,000
nanometer. Nanometer.
600.
नैनोमीटर भी ठीक है, 600 है, ठीक है. प्लीज रिमेम्बर इट, है ना, डोंट फॉरगेट इट. यूजेस इन ईएनटी, आई टोल्ड यू कि जैसे आपने याद किया तो उसको ब्रेक करके याद करेंगे, इट इज बेटर. अदरवाइज अगर दे आर सिंपली आस्किंग फॉर 2 मार्क्स तो राइट एटलीस्ट 2-3 यूजेस. ओके, व्हेनेवर दिस CO2 लेजर कम्स टू योर क्वेश्चन, आपका दिमाग में तुरंत सी पटेल का इमेज आना चाहिए. सी कुमार एन पटेल, द पर्सन हु मेड और इन्वेंटेड दिस CO2 लेजर. ही इज अ इंडियन. Okay, there are few places जहाँ पे Indians are way ahead. Okay, so that those things are like quite likely to be asked from us. So one is give Dr. Sab. Then second question I'll just reiterate over here only. Dr. Rishikesh Pai sir, है ना, he is faculty from Manipal. I don't know अभी कहाँ पे है. When I was resident तब सर उसको मणिपाल में हुआ करते थे. And सर का नाम, sir's name is there in the hypopharyngeal malignancy in Scotland. Okay, so few places. So there is a possibility कि if a examiner is there who is like who wants to test you कि तुमने you know about Indian authors or not. So he might ask you. And you remember these are the small nitty-gritties. Okay, now identify what instrument is this and what if Jesner's solution, where is it used? Okay, so this image is from Scott Brown itself. This is a electrical dermabrasion machine. इलेक्ट्रिकल dermabrasion machine. ठीक है. What is Jesner solution? Second time it's being repeated. Please go through it. It is important. ठीक है. And where do you use it? This is used for peeling, chemical peeling. Okay. Now, again one more thing. Now identify the disease. What if Trotter strand? Let's go through go through 4 images which are in front of you. This is our tympanic membrane. This is image of your nasopharynx. Again, an image of nasopharynx, and this is a scan of the same thing. Now, did something hit you? What is the disease? हाँ. So अगर ये नहीं भी पता होता, ठीक है, if there might be someone from you, there will be, I'll not say there might, there will be someone जिसको नहीं समझ में आएगा कि what if thing being is asked. So please go through the second question, Trotter strand. Okay, so when they are asking you what is Trotter strand, and so this has to be something related to Trotter strand. Okay, can somebody take a try and tell me what is Trotter strand?
Conductive hearing loss.
Yeah, this is ipsilateral conductive hearing loss. ठीक है, because of eustachian block. Then
Palatal palsy.
yeah, there is ipsilateral palatal palsy due to the involvement of your vagus nerve. Okay, and then third thing,
Temporopathal pain.
yeah, there is facial pain. ठीक है, because of your involvement of your mandibular division of your trigeminal nerve. ठीक है, so the answer goes as your nasopharyngeal carcinoma. Okay, I'm not into the details of nasopharyngeal carcinoma in today's session. Okay, so what you have to study in nasopharyngeal carcinoma are basically 2-3 things. First is your etiology. We will go through it this NPC during the nose case, which will be dealing about CRS ना. So उसमें we will go through it. What are the questions which will be asked? So then this is the etiology. Here EBV is important. Apart from that, there are multiple genetics, environment, and see if somebody asks you what is the etiology of nasopharyngeal carcinoma, so directly don't jump upon EBV. Your answer should be divided. Okay, you should say, sir, there is a genetic cause. Bhale you remember or not, just take the name of heading. Sir, there is environmental cause, and sir, there is some viral cause. So viral you have EBV. As you will say EBV, the second question will be what other diseases are caused by EBV. So the answer will be Burkitt's lymphoma, Hodgkin's lymphoma, or any other lymphoma or any other thing you remember. So EBV का एक तो NPC हो गया. Apart from that, Burkitt's lymphoma, Hodgkin's are also important. Environmental में this is seen more in China. ठीक है. Then there is a province called as Guangdong. Okay, so this tumor is called as Guangdong tumor, and in genetics there is HLA2 which is involved. The second question which you should know about is that spread. ठीक है. Spread में you'll read about this in sinus of Morgagni, pterygopalatine fossa, how it's going, that is important. Clinical features we have already seen, ऊपर देख लिया है. Staging is important. Here 2 types of staging is there. One is your TNA which you follow, and second is your host staging. Okay, host staging of lymph node. Please remember it. And जो requisite इसकी like other images are there that we will be dealing it, not an issue. Okay. ठीक है. So this covers, I'll say, not everything. Everything cannot be covered. ठीक है. Most of the things. Some things are remaining, like your incisions in rhinology. This is remaining. Osteotomy sites is remaining. Olfactory pathway is remaining. Okay. So whatever questions, like we have mentioned, कि इसको पढ़ना, this is important. Please go through it. And if you, in case you have any difficulty like getting through those questions, I'll request, don't bang your head, just drop me a text, like having trouble in so and so thing, just let me know the answer, है ना? I'll share it on the group also, like in case somebody else is going through the difficulty. Okay, so just a minute. The next class will be on अभी तो स्कल बेस का बाकी है ना? So second will be important one, skull base, है ना? Skull base is very important. It will be repeated twice at least. Okay, all, and जो उसके components हैं it will be shared on a regular basis. After that your viva on CA larynx will be there. Basically case discussion. There is no fun in telling कि ये गलत है वो सही है. I'll lead you to the case presentation, how to go about a case presentation, what questions you can expect, how to answer them. Okay, there is nothing called as कि वो 2 घंटे में you'll get knowledge. No, that you have already read. I'll tell you what to read, from where to read, what is the material to be read, and how to answer in the exam, what questions you'll get in exam. Okay, so these are the things. चलो, anything else for me? Any points? Positive, negative? चलो, thank you so much, Dr. Okay, bye.